International Modern Hospital Superheroes. Only on 105.4 Radio Spice. Full to Twisted.
Hi guys, okay, so I'm here with from Radio Spice, 105.4 Radio Spice, Full to Twisted, and we are currently at International Modern Hospital. आज हम मिलने वाले हैं डॉक्टर गिरीश जिनेजा से. He's a specialist general surgeon and the head of bariatric surgery. He's one of the most well-experienced weight loss surgeons in UAE. So as you can see, there's going to be a lot of waiting time to meet the superstar, but that's what we're covering, the superheroes of the real life. इनको पता हो या ना पता हो, but Dr. Girish Jineja was on air with me very recently and we had a brilliant response. I think this speaks a lot about UAE, which we will get to in just a bit, but Dr. मैं पढ़ रही थी and there are these big words. Bariatric, pancreatic, gastrointestinal, hepatobiliary.
एक टंग ट्विस्टर तो नहीं है?
Too many big words जो कि मेरे सर से bounce होके चले गए. तो exactly होते क्या?
These are medical terms, laparoscopy. So all these procedures, it's a technique. In common words, we can say keyhole surgery.
Okay.
Means we don't cut it open like traditional surgery. We make small holes up to 1 centimeter, and then instruments like laparoscope goes inside. And that's the gastric balloon. It's done through endoscopically, but through mouth. So it's without surgery, and the people on an average 10 to 20 kilograms they lose. So it's a good option for them without the risk of surgeries.
So is like there's a balloon in the stomach.
Yeah.
That's what it is.
That's what it is.
और फट नहीं जाता?
No, it's made of such a substance called Teflon.
Okay.
So a minimum 6 months that it can resist all the gastric juices and all. So usually there is no chance of fatne ka.
And after 6 months?
After 6 months, we have to remove it.
You should remove it.
If you keep it, then risk is yours.
Okay.
And then gastric band, sleeve gastrectomy, and gastric bypass.
Okay.
Now, gastric band, as obvious, कि हम लोग stomach around a gastric band through laparoscope, we give the restriction to the stomach, so that the amount is restricted. A person can eat.
They eat lesser.
30 to 50 ml only.
Okay.
So that's gastric band. Now sleeve, again done laparoscopically. Keyhole surgery. Now we cut the stomach around 70%. In bypass, word comes from the thing that 150 centimeter of intestine is bypassed.
BMI के पीछे लोग भागते होते हैं. ज़्यादातर लोगों को ये पता नहीं है कि exactly what is the BMI and what is the ideal BMI for that person.
जी.
So what is BMI पहले तो?
BMI in full form, it is the body mass index.
Okay.
Now it is calculated as per your weight in kilograms and divided by height in square of meters.
Okay.
So the figure which comes out of this is called BMI.
Okay.
Now it has a relation with type of surgical, non-surgical treatments of obesity in medical community. So up to 25, 18 to 25 is called normal range for a person. Means you are healthy from weight point of view. You can be unhealthy even, but normal weight is between 18 to 25 BMI. From 25 to 30 is called overweight category.
Okay.
So there the diet and physical exercise and different things play a role if you want to come back to the normal. From 30 to 35 is called obesity.
Okay.
And above 35 is called morbid obesity, means obesity which cannot be controlled non-surgically or it causes a lot of diseases in the body.
As you can see, I'm pretty dressed up.
You have to get the mask also.
Okay, why do I have to wear a mask?
No one cared who I was till I put on the mask.
As you can see, I'm very dressed up. I don't even know if you can hear me right now. But this is because we are going to the OT, that is the operation theatre. So I'm going to try not overacting anymore.
Hi, my name is Alicia.
Aaron. I've undergone the gastric sleeve process.
Gastric sleeve surgery.
Lab band surgery with Dr. Girish.
Before the surgery, I was having high blood pressure problem.
Diabetes.
My knees and feet bother me quite a bit.
High cholesterol. What else? Of course, when you're fat, when you're overweight, the confidence level is really low.
Since the surgery, I've lost 40 kilos now.
Let me guess, 42 kilograms.
Good. Breathing is also better now.
The lifestyle of mine has been changed. I already changed 4 times of my clothes.
The only problem though is I had to buy clothes like in three times already after the surgery because I lost a lot of weight. So, but it's a good feeling though.
I don't feel hungry. It's already in my mind that this is the amount I need to eat.
I really recommend having one of the processes done, especially with Dr. Girish. He's really been very helpful. This is a life-changing experience.
Was amazed not only with the amount of knowledge he had on the subject, but his willingness to share it with me, and he was available anytime.
So really thank you Dr. Girish for doing the surgery, and thank you for your staff who operated me.
It has been life-changing, amazing, and I'm so glad that I did it. I would recommend anyone who has struggled with their weight and has tried every other possibility to consider this as an option, and especially with Dr. Girish. He has been amazing throughout the whole process, and I really feel like he gave me back my life.
Superheroes at International Modern Hospital, Bardubai. Call 04 406 3000.